It is 1 o'clock, so we can go ahead and get started. Checking to see, do we have education here?
Yes,
I'm
Julie's on.
here.
Hi, guys. Thank you. And then do we have Kelly or Colleen with us?
Hey, this is Suzanne. I'm here for Kelly.
Thanks, Kelly. Or Suzanne. Gosh, listen to me. I said Kelly, and you just told me you're Suzanne. I knew that actually. Knew she was not going to be here. And Kelly Vaughn or Colleen?
I thought I saw Colleen on.
I'm on here.
Yeah, there she
Oh,
is.
there she is. Yep. And then I thought I saw Crystal. Is Crystal here?
Yes, Crystal was on.
All right. So it appears we have a quorum. All right. Can we get approval of our April 30th minutes that Gabby sent out?
This is Rachel. Oh, perfect.
Thanks,
I
Rachel.
second that, Nadine Lynch-Masco.
I'm sorry, who was that?
This is Nadine Lynch-Masco.
Thank you.
Well,
All right. Perfect. And then do we have any new members with us today? We don't have anybody new?
That may be a first.
I know.
Hey Becky, this is Stacy. Hey, great.
Stacy.
I wanted to introduce Tanja Span. She's one of our newest trauma data abstractors. Welcome to GCTE, Tanja.
Welcome, Tanja. All right. If we don't have any other new members, then I think we're ready for our standing reports, Lynn.
All right. Well, first of all, I just want to thank everybody for joining in. I hate this is my first meeting of the year that I've been to, which is terrible to say, but as most of you know, I was on medical leave at the beginning of the year. For a couple months, I came back, and a week later, lo and behold, I got picked for a 2 week jury duty. Never been picked for jury duty before. But anyway, that's all in the past. The last half of 2026 is going to be much, much better. um, and thank you to Becky for running things while I was out. You know, she got thrown in the fire, but I know she's done a great, great job from everything I've heard. And I truly, truly appreciate you, Becky. And I'm sorry for throwing you under the bus. um, so with that, we'll go ahead and get started. Liz, Georgia Trauma Commission update.
Yeah, hey Lynn, can you hear me okay?
Yes.
I'm driving through a spectacular thunderstorm on the east
Oh,
side of
please be
Atlanta.
careful.
Yeah, and for whatever reason, hopefully we'll keep the connection and everything. Anyway, I just wanted to say welcome back. We're so happy that you're back and you're well and everything.
Thank you.
So
Thank you.
Yeah, and Becky did an amazing job stepping up to the plate. She got her baptism by fire. So not recommending that any other GCTE chairs check out on a medical leave, but you know, it's always good to have a good bench depth, and I'm proud of
That's
that.
right.
It's always had that. So anyway, I'm going to pass off a lot to my colleagues, but I just wanted to give a couple updates. First of all, if you didn't notice, I think all the level fours are aware, but the college released the level 4 standards. Amen. Only 2 years too late, but whatever. At least they're out, and they're in the same format as the level 1, 2, and 3 standards, which, by the way, are undergoing revision at this moment. But nonetheless, the standards are out. To take a look at those. It's, you know, since we've been going by the old orange book ones for so long now, level 4s, you'll get to familiarize yourself with this measures of compliance piece that the college now includes. It makes it a little bit more straightforward for site reviewers to make sure that what you're submitting ensures that you're compliant with the standards. So please take a moment to look at those. You have to actually put in your email on the college website to access and download the document. So we can send the link if for whatever reason you didn't get the link communicated with you. And I will say, while we're on the topic of level 4s, that I talked with the college about how we're not really sure how much value there is in the NTDB report that some of you can't even access. So there's going to be representatives from the ACS at our meeting primarily on Wednesday for the optimal course, but they will stay over on Thursday. So, and they're very interested in feedback about what could make that NTDB report more helpful. Because I think several years ago, many of you took the paper performance requirement out of the level 4 requirement to submit NTDB data because the thought was that you weren't really getting anything meaningful back from it. But if there is a way to get something meaningful, we're all about that, and we certainly want to support whatever the college is willing to hear out on what we think might be meaningful information to give back. I have not seen that level 4 report in ages. So I would certainly love it if anybody can get their hands on it. It's just high level overview aggregate. There's nothing benchmarking in it to my knowledge from, that would be a patient specific or whatever. So maybe we can talk about that, or someone can share a copy at the GQuip meeting. Gabby's going to give you a little bit of details about the meeting because we're in the final stretch now before we get to Jekyll. And then Gina will talk a little bit more about GQuip, but many of you have already heard, you've already seen the communication come out that we are moving the central site platform from the ESO central site to DI's new central repository. And I will just say that there was sort of a constellation of circumstances, as is always the case around those things. The state's contract with ESO was up, so we were out of renewals. So we would either have had to go down a whole procurement source on that. And so we were kind of forced to look a little bit to see what was out there, and keeping in mind that we are no longer, we're now a multi-vendor environment. So we no longer have that homogeneity in our data sources that we had in the past for 20 years. We were basically, or more, we were basically all on the same vendor, but it's a different environment now. So really we just needed to modernize and be able to accept a variety of different proprietary vendor source data files. So that was a primary driver behind that. And some of you, if you're not now, and you may be involved shortly, we're trying to come up with what would look like a statewide dashboard. So we can have some, process measures and just not necessarily outcomes, because GQuip really deals with that. There might be a little bit of crossover with that, but just to be able to show, everybody, including all the stakeholders involved, what's the efficiency of our system look like? How are we doing? How are we, with the outcomes we're getting? What are I think the processes, and many of you have your institution or facility specific dashboards, so you know what I'm talking about, but just something to say, hey, like, are we on the mark, or where's the pain points? Where do we need to focus our energy? So ideally with the new platform and some of the technology that lies within digital innovations and their business partnerships, it's looking pretty promising as to what could be achieved on that end. So Gina will give you many more details on that in her GQuip update. But Gabby, if you want to update the group on the final meeting reminders before we all head to Jekyll in a couple weeks.
Sure. So this draft was sent out with the registration information. I will send out an updated schedule once I get the finalized agenda items for each meeting. But for the Wednesday course, it will start at 8 a.m. and we will likely get out a little bit before 5 o'clock, and that's going to be the optimal course. It did have a separate registration, and registration is closed, but if you're still interested, just email me and we will see if we can fit you in. And then we have our commission meetings on Thursday, August 20th. These are open to the public. No registration is needed to attend the Thursday meetings other than the dinner. They all have a hybrid option. It'll start at 9 a.m. with the Georgia Trauma Commission meeting. We have the RTAP coordinators meeting at a different room, the club ballroom. And then we also have the Trauma Administrators Committee the afternoon. And then Friday is going to be our GQuip summer meeting. Registration was required for this. Again, if you need to register, please send me an email. It is getting very tight in the room. So we're trying to limit late registrations. But again, just reach out to me if you missed the registration deadline.
Thanks, Gabby. Appreciate that. If you're a required attendee, and you're having issues or there's some issue, please reach out to us sooner rather than later. We don't want to not have you attend a required meeting and we weren't aware of what was going on. So if you could just reach out, that would be great. And I think that's pretty much it for me, Lynn, unless anybody has any questions.
So I was going to ask about the level 4 standards. When were they going to affect? Like immediately now? Or do they
So
have a grace
remember
period?
yeah, that would be a great question for us to ask at the commission meeting when the state office folks are present, because remember, the college doesn't really, they don't dictate the level
Right.
4 process because there is no process for level 4s with the college as of right now. I will say that. So we can ask April when they plan to start holding folks accountable. That's a great question, Lynn.
Okay. All right. Well, thank you, Liz, and be careful driving.
Yes, thanks. I'm going to pop off for a second, but I'll be back on in case anything else comes up. Okay.
Okay. Thank you.
All right. Thank you.
All right. Next up, the GQuilt report from Gina.
Good afternoon, everybody. Can you hear me okay?
Yes, ma'am.
All right. Just want to make sure. Thanks, Liz, for teeing me up to talk about the GQuilt Central Repository transition. I know that always brings a little bit of angst, including to myself, when we change things. So the big things right now is no more submissions to the ESO Central site. And I think I've communicated that to everybody. I know we had conversations about that to the registry subcommittee that went out in the initial email. I know we're not due a submission until September 1st, but everybody will proceed with their submission to TQIP and OEMS&T as normal with the September 1st timeline. We right now are kind of still in the contracting process, so I do not have a time frame of when the new platform will be up. I am hopeful that we will maybe only be a month behind to receive that download. So I will be communicating when I have more information with everyone as soon as I have it. So the key things are right now is just there will be no September 1st download to GQuip, and do not download anything else to the ESO platform. One of the first things we will do is data migration from the current GQuip Central site to the new Central site once we get the contracting piece worked out. So we'll be able to move the data, which is fantastic. So we won't lose anything. Arbormetrics update. Actually, I just today sent out everybody's Q3 GQuit report cards. So many thanks to Sarah for working very hard on those. And please give us feedback on those. We've gotten some great feedback in the past, and we've tried to incorporate those because we really want them to be useful to you guys. So if there's anything that you see in the report cards that you think might be an enhancement or make them a little bit easier for you guys, let us know. Don't hesitate to provide that feedback to us. The meeting, as Liz and Gabby mentioned, is coming up, and it'll be a full day and a full house, which is great. We have some great presentations coming up. We have Dr. John Holcomb as our keynote speaker, and I'm very, very excited about that. He's going to talk about trauma resuscitation and pre-hospital blood will be kind of the highlight. So he is well known in the trauma circles about his work with pre-hospital blood. I think they call it the pre-hospital blood mafia that he's a part of. So he's very down to earth and a great speaker and very knowledgeable. So I'm very excited to have him joining us. For those that are joining, you should have gotten emails from me about completing the confidentiality agreement. And that is, even if you're not part of the closed session. So because there's a lot of conversations that go on, so we want to make sure that we protect that. And for those that have already completed it, thank y'all very, very much, because really the majority have. So I appreciate it very much. We also have our 2 new GQuip research fellows that have joined us July 1st. Anna Medea is with us for 2 years, and Caroline Wasserman will be with us for 1 year. This is the first time we've kind of had 2. Dr. Sharma is actually mostly supporting one of them through Emory, but they are both fantastic and delightful, and they will be there at the meeting. And I think both of them may actually going to be taking optimal, so they are very eager to learn and help out with projects within GQuip. Also, it's kind of hot off the press. I know that Rama has not even sent it out yet, but we have been working on a geriatric case review template. This was something that Dr. Young Chi came up with. I know geriatrics is kind of really on all of our minds. We've got the biggest opportunity there, except for our PED centers, to make some inroads with. And so we have been working on kind of a tool to help review those cases when we have less than optimal outcomes. And we're kind of really excited about what we've pulled together there. We've also included some of the CMS age-friendly measures with those, because all of the facilities that have those populations are going to have to do that. So PI subcommittee will be seeing that. I sent that to Rama today. And Dr. Kat Kohler kind of stepped in and helped us with that. So we hope to have some centers pilot it and maybe some edits on that. So more to come on that. And I think that's all I've got for GQuip. We are headstrong into the meeting. Oh, and I know the 2027 NTDB data dictionary also came out recently. So we'll be going through that, and we'll be working on the GQuip data dictionary very soon, especially with the build of the new platform. It will also have to change a little bit because, you know, we've kind of catered it to the ESO registry. And now, as Liz mentioned, we're kind of not on all of that platform anymore. We have different registries coming in. So the GQuip data dictionary will have to be a little bit more vendor agnostic. So it'll probably have more of a NTDB data dictionary feel. So we'll be working along that. So you may find me reaching out to some of this group to provide some feedback, because that's really important to us. I want to make sure that it's very user friendly for the group. So happy to take any questions.
All right. Well, thank you, Gina. I'm very looking forward to GQuip as well, and to Dr. Holcomb's presentation. Sounds like it's going to be very interesting. All right. So if no questions for Gina, we'll move on to our RTAC report from Crystal Shelnut. Is Crystal on? I don't see her. I don't know if she's just going to join later. We'll skip over her and come back. So that goes to OTCPE report updates from Marie.
Good afternoon, everyone. This is Marie Probst, and I will be giving Stacy's report in her absence. She is attending an ACS site visit today. So I will cover the OTCPE update in her report and just tag on to that. But as far as the registry goes, the things I want to mention are the 2025 annual report is underway. Dan Lynn's been working on it for a little over a month, so we are looking forward to that coming out in the fall. The 2026 quarter one import of your January through March data came in June, and I have to say it was the best submission period from the past 2 years, and that is regarding timeliness. So thank you everyone for sending in your downloads timely, and it had the fewest system and schema errors. So I look forward to the next download that's coming up due by September 1st, and that will include your January through June 30th data. For 2027, the data elements are being considered for the state download to the Office of EMS and Trauma's Image Trend Patient Registry Central Site. Now that the 2027 NTDS data dictionary is out, I'll look through that and see if there's anything we need to that fell off of the NTDS list that I need to put into our Georgia Extension list, which are the additional fields that we require outside of the NTDS and ITDX data sets. So once that's done, then the annual schema information will go to Image Trend for what we are asking for from your individual registries. And Image Trend will prepare that schema, send it to the vendor, and then your vendor will prepare the annual update, and then you will receive it in sometime, hopefully in the spring, so you can install it and begin doing your 2027 downloads by around March. That's a really ambitious timeline, but we can be hopeful, right? So on to Stacy's report again. She's sorry she can't be with us today on the call. She's attending the ACS site visit. But we want to thank everyone for your hard work and dedication. We appreciate everyone working on the Q4 OTCPE and OBCPE reports, which include the annual data performance measures and program questions. I will say we are missing 3 reports from 3 different centers, so please submit those by the end of the week if you are able. If you're having trouble with the site or need your password or login reset, let me know. I'll be happy to take care of that for you. And for those of you that have already submitted your reports, thank you. And please remind your trauma medical directors to log in and sign the attestation form, so the status will progress on to Stacy's bucket so she can review it and close out the Q4 fiscal year 2026 reports. So the next thing she wanted to let everybody know is that this has been a really busy year for the Georgia re-verifications and designations. We congratulate 7 centers for their ACS verified and state designations. And these are not in any date order, but so we want to congratulate the Level 1 Atrium Health Navicent Macon, the Level 1 Memorial Health Savannah, Level 1 Pediatric Center, Children's Healthcare of Atlanta Arthur Blank Hospital, the Level 1 Adult Trauma Wellstar Medical College of Georgia, Level 2 Pediatric Trauma Wellstar Children's Hospital, and Level 2 Atrium Health Floyd, and Level 2 Piedmont Athens. So congratulations again to all of these centers, and thank you for all your hard work for being successful trauma centers and providing the best care for our patients and families in Georgia. There are other centers who completed their ACS visits, but and to those centers, please don't feel left out. But due to the official letter not being sent, we will announce your center's redesignation or verification at the next meeting. The next item is the Systems of Care Advisory Council OMST meeting will be held September 8th. If you have any questions about that or need virtual links or information, please reach out to April Moss. We encourage anybody to provide us with suggestions on changes to the OTCPE or OBCPE for the fiscal year 2027 report. Just send those suggestions to Stacy and I, and we'll take a look at them and try to incorporate those changes into the fiscal year 2027 report. We will start working on those revisions to the new form towards the latter half of August. And that form won't go live until September 15th and be due October 15th. So we have some time for that. And finally, as Liz and Gina talked about, the level 4 standards were released by the American College of Surgeons. We waited a really long time for these standards. Stacy emailed an electronic copy to all of the level 4 TPMs. They are, of course, available on the ACS website for you to download that. After GQuip, she would like to meet with Liz and all the level 4 TPMs to review the new standards, discuss any questions, and gather your feedback. And this will help to ensure we're all prepared to implement the standards for the 2027 designation and redesignation cycle. And Stacy will send out a survey for the best dates to accommodate the group. Any questions? Hearing none, I'll pass it back to Lynn. Thank you, everyone.
Thank you, Marie. I do have a question. Do you have a deadline for the suggestions for the revisions of the report that y'all are working on for the next one? You said you.
That's a good question. Since the form will go live September 15th, if you can send us your suggestions or requests for changes by the end of August, so August 31st would be the latest, so we can consider it, put it in the form, because I have to update the form, and if we have to work some magic to get it to do what we want it to do, it may take a bit of time. So that'll give me a couple of weeks to get it done.
Okay. Thank you, Marie. I appreciate you.
And you're welcome. Thank you, everyone.
Okay, next up is Trauma Foundation update from Cheryl.
Good afternoon, everybody. As you know, one of our programs involves coordinating continuing education at no cost for anyone who works at rural or critical access hospitals. We are currently scheduling courses for the first half of 2027. So if you work at a rural hospital or know of someone at rural and critical access hospitals in your area who needs TNCC, ENPC, ATLS, ATCN, or RTTDC, then please reach out to us. The number is 404-394-2912. Also, if you are an instructor for any of those courses or some of the NAEMT courses, we would like you to be a part of SEED. SEED is our statewide continuing education instructors database. It's really your one-stop shop to look for instructional staff for advanced continuing education courses. In addition to using it to look for course instructors, we invite you to be included in the database if you aren't already in it. We only include you if you want to be included. So if you are interested in making yourself available to provide some of this instruction, then also give us a call at that same number, 404-394-2912. The last thing I have is that Trauma Awareness Day is going to be coming up in January. We are making some changes now to improve things for next year. One of those things will be an advocacy training that will be held prior to our visit to the Capitol. It will benefit you for the work that we're going to do on that day, but it will also help you be effective at any time that you're reaching out to lawmakers, Tyler Bryant, our community engagement and development specialist, will be the one on staff who will lead that effort. We will provide you with more details on that soon. Tyler is on the call now and will now share more information with you on some other upcoming events.
Thank you so much, Cheryl, and it's good to be on the call with you guys again. Just wanted to give you some quick updates about some regional events that are happening this fall to support trauma care in our state. Flavors for the Frontline is going to be in Region 9, specifically at Ships of the Sea Maritime Museum in Savannah. And we also have Heartland Festival going on in Region 5 in Dublin at Southern Pines Regional Park. These events are going to be a way to bring our communities together with sponsors, vendors, and other partners to raise funds and awareness for trauma centers and trauma education, trauma professionals, all the things trauma across our beautiful state. So we're in full swing with those things, y'all. I just want y'all know that we are looking at sponsors right now. So if you know anyone in the area that might be wanting to partner with us on this event, we would be more than happy to talk to them. You can send them my way. You can send them to me by email. My email is Tyler, Tyler, at Georgia, spelled out, georgiatraumafoundation.org, or you can call me at my office line, 478-960-1685, 478-960-1685. And anyway, again, I just want to say thank you for all y'all do in our state, and we'd love to have you part of these events in Region 9 or Region 5. 5 event will be on November the 7th, if I didn't mention that before. But thank you so much for taking. I yield back.
Thank you, Cheryl and Tyler. That's some lots of great information. I'm very excited about the advocacy training. I think that would be very helpful too for the day at the Capitol. Would you mind just dropping your phone number and email address in the chat? Just make sure that everybody has it that you just called out.
We'll do it. Thanks.
Thank you, ma'am. All right, so now we'll move to our subcommittee reports. First up, we have Julie from Education.
Hi, everybody. Hope you're doing great. Pretty brief update. Our big goal for this year was to work with the GCTE leadership. Thank you so much to everybody that was involved to do the topic and optimal courses. As mentioned, that optimal course will be supported by the Georgia Trauma Commission, and that will be in conjunction with the GEQUIP meeting. Gabby gave lots of information. If you have any questions about that course specifically, reach out to me or specifically to Gabby, because she's been the queen of all that planning. So we are looking to make a goal for the sort of second half of the year, since we achieved our big goal early on. So that's what we're discussing now. As always, if you're have any interest in joining the group, reach out to me directly. I will happily put my email in the chat, and looking forward to hearing from everybody soon.
Julie, I do have something to add, hot off the press.
Perfect.
For the injury prevention course, the virtual 2-day that's hosted by the American Trauma Society, we were able to finalize some course dates, which is going to be Thursday, November 5th through Friday, November 6th. It's a 2-day virtual course. We'll send out more information and registration information after we get behind all the GQuip stuff. So just wanted to mark your calendars and make you aware that that's coming up.
Thank you so much for the update. For everybody's just reminder, that was part 3 of 3 of our overall goals. So topic optimal in the IP course. Thanks, Gabby and team, for all the hard work you did.
Yes, that is great. So glad to have that finalized as well. Gabby, just curious, did the optimal class get full?
We still have some slots. We have 72 enrolled right now, and the room can hold up to 100. So if you are still interested, just let me know. We do have to finalize everything probably by next week, since the course is going to be on the 19th.
Okay. Perfect. All right. So if you hadn't signed up yet and you want to go, call Gabby. It's going to be a great course. I'm really excited about it. And yes, thank you for all your hard work with all those courses, getting them lined up and doing all the logistics.
Of course.
All right. So next up is our pediatric report. Suzanne?
Yes. So we are happy to report our biggest project for this year is updating the pediatric imaging toolkit that was initially sent out in 2018, 2019. We realized that in our revamp, we just essentially needed to redo it and kind of start from scratch, really focusing on standardizing imaging practices for children, trying to reduce unnecessary radiation, and really just incorporating evidence-based clinical decision making. So, kind of incorporating the Pediatric Emergency Care Research Network, also known as PCARN, into a lot of that. So, our document is complete. It's currently under review by the TMDs at CHOA. We also have it going to our radiology and pediatric emergency medicine liaisons. And once they review and edit, we're going to send it over to CHOG for review from their team. And then once that's been finalized, we'll be getting it to the GCTE committee, hopefully for endorsement and distribution. So hopefully that will be finalized here within the next month or so. The other project that we're working on that's kind of taken a back burner is the pediatric transfer toolkit. So we initially kind of came up with a one-pager front and back quick reference for assessment, stabilization, and transferring PEDS kids. So we have that one pager, but what we really wanted to do is also kind of come up with a trifold quick reference tool that we can distribute. That we have kind of done the mock-up for the trifold, but it definitely needs some finishing touches before we send that out for approval. So hopefully we will get that done by Q4. And that is really it for our updates. We are still in the MATIC-2 pediatric whole blood transfusion study. It was actually, completed at Scottish Rite. It's ongoing at Arthur Blank, and they will be switching from component therapy to the whole blood arm in spring of next year. It is, the study is going a little bit slower than they expected. It's taking a little bit longer to get the volumes, and part of the rationale for that is that they're thinking that due to EMS, having access to whole blood and giving it, that it is decreasing the need for MTP once patients arrive to the hospital. That was one idea that was thrown out for the team. So hopefully we'll have more concrete data to provide this group at our next meeting.
All right. Thank you, Suzanne. That's great. Very excited about the updated imaging toolkit. I know it's very useful for a lot of centers.
Good. We hope so.
Yes. Okay. Up next is our process improvement, Rama or Ashley. Not sure. Rama's on.
I am. Hello, everybody.
Hi.
We've been continuing to work on our PI toolkit. Our last meeting, a lot of people shared a lot of their tools. And they are all now uploaded, that everybody shared with me are now uploaded in Basecamp. Piedmont Athens, Advent Redmond, and Atrium Floyd all shared some of their tools. I had shared mine previously, and those are on there as well. So if you have more, just keep sending them to me and I'll get them added. You can add them yourself as well if you have access to Basecamp. We started our discussion also in that meeting for working on geriatric trauma care. We reviewed some geriatric trauma activation criteria from a couple of different centers. That's a big focus for GQIP, as Gina said earlier. She sent me what her and Dr. Ayang Chi had worked on, and so we'll have that for our next meeting. Hopefully we can get that scheduled in the next few weeks to have another PI meeting. Also, we shared some different frailty assessment tools and discussed different assessments that are being utilized at different centers for the geriatric population, as well as what age each facility considers geriatric. I know some start at 65, some start a little bit earlier. Again, Gina offered us a space on Basecamp, created that same day and gave everybody access. That is just a blessing for us because now it's easily accessible to everybody. I have had a couple other suggestions by some people that I'll have at our next meeting as well. So people could be thinking about it. People that utilize the PI module in your registry, and I know we'll be changing registries, but until that time for people to be able to use it, if you're proficient at using that PI module, if you could share that, maybe do a Zoom meeting with somebody or to help them understand how its function and how to use it. So we'll talk about that at our next meeting as well. And that's all I got right now.
All right, thank you. That's great work. Lots of great things coming down. And y'all do a lot of work. Really appreciate you.
Thank you.
Okay, now from our registry committee, Kelly.
Hey, everybody. From a registry perspective, we have a few things going on. I think someone mentioned earlier, we do have the new data dictionary. I got the email this week that it was released. We met a couple of weeks ago, so we haven't had a chance to discuss that as a group, but I know it's out there. The main thing we talked about were our the vendor product demo and steps, what we needed to do moving forward. And in talking with the core group that did this last year, there were about 3 or 4 of us that kind of really tackled this beast. We discussed creating a needs assessment, and if y'all will remember, the outcome of that report was that no one size fits all or no one registry fits all. And so we thought we could develop a needs assessment for centers or for systems to complete as a group. Pull in your IT people, pull in your nursing, pull in your quality, whoever you needed, and complete this needs assessment. And then within your center, or centers, however you work with vendors to review the different registry products. I mean, Liz alluded to it earlier. We're no longer the state that has one registry for every center type state. So we did not want to create a needs assessment or create a report that would force centers to go to something that didn't align with what they needed. So the needs assessment was sent out and the contact information for all the vendors were sent out to the group. And the other just minor thing for those of you trauma program managers that don't listen to the registry subcommittee, I was asked, I've been asked several times about the attendance list and how to best note that for your verification visits. We've changed the way the attendance is captured now, and Gina has a great solution. And so we took that list, that's now uploaded to Basecamp. So when you need your documentation for attendance in these committees, the committee meetings, you can just go to Basecamp under the registry. You can download the PowerPoint, you can download the attendance list. So that's done. And then we talked a good bit about inter-rater reliability, specifically with the smaller centers that only have one registrar, or maybe you have a TPM that's doing it all. We don't have a solution yet. It sounds like Qcentrics, which was the solution for introduced about a year and a half, maybe 2 years ago, is still ongoing in some centers. And so we were going to give that process time to work all the way through and brainstorm about ways to help centers that only have one registrar or one person do some sort of inter-rater
reliability. I know Gina provides a GQuick report that helps you, or they've just started this data logic report that can help you with your IRR, but you're probably going to need more than that to meet the percentage for validation. And then the last thing that we did, we've had a lot of centers lately submitting us information or questions about scenarios or diagnoses or procedure codes, or how do you capture this patient, everything related to the registry. And so I would say probably 20 minutes of our meeting are covering these different topics. Once the group talks it through and we come up with a decision, that's also put in Basecamp under registry Q&A. You'll see the date, what the question was, and kind of what the group decided. So it's becoming our own little change log for issues that we discuss in the registry. And other than that, that's all I've got.
Well, that's a lot. I really love loading the attendance logs into the Basecamp because you're right, with the ACS getting ready for that. I mean, going here and there and trying to figure out where those are. That will be a huge help. All right. Next up is injury prevention, Crystal Smith.
Hey everybody, this is Crystal Smith. Show of hands, if you know how to use your emojis, if you've just received a message regarding our bleeding control blitz. Just show of hands real quick. Then I don't know if I can see it or if you can see it very well. I'm seeing a couple hands. All right. So our goal is that you'll send that message out. So if you're not seeing hands raised, we got more people that need to be getting it. So our last day of the bleeding control webinar blitz is this coming Thursday. We're having a lot of fun with it. I will say attendance is down, but again, I do kind of expect that. Our email doesn't do as well as it should about getting out to folks. And I did learn from my contact with the Georgia Department of Education. It turns out she didn't get the emails out to her teams as well, and several of their contact lists are out of date. So if you've got more if you got local contacts, please send them to your local contacts. Just realize our Department of Education friends can't help quite as much. There's been a lot of turnover, understandably, year to year. And again, our principal contact was actually out on some medical leave, but she still did try to get it out when she was able to. So get it out, turn out. It's been a lot of fun. We've got new instructors. Lots of instructors have come on to help. And especially with some of these in-person classes, I'm meeting some great folks that are really excited about the program. But it is not too late to share, even though we have just one day late. Go find that email, dig it up, send a new one out to your local contacts. Let's get some more folks in the virtual classroom. I do expect tomorrow to be Thursday to be the biggest day of the Blitz so far. And we're doing a few less days and a few less webinars this year just because everybody's getting back to in-person, but it still serves an important purpose, filling those gaps where we can't get to those folks just yet, and affording us the opportunity to make some connections so that the next opportunity to get in there and do some hands-on stuff, we can. So just, again, show your hands if you've gotten that text by now. Want to make sure everybody's caught up. If there's anybody that hadn't, let us know and we'll get that message out to you. We want to make sure we're reaching you and getting everything out to you. Okay. Hope you enjoyed it. Little cutie there. If you've taken Stop the Bleed 1,000 times or you've taken it one time and you want to come see what the webinar is, everybody as a rule kind of says that webinars, just aren't fun, that, they certainly aren't as good as in-person classes. And while we do agree that they're not as good as the in-person offerings, I think we would challenge you to say that you won't have a good time in our webinars and we can't keep your engagement all you have to do to stay on task and have a good time in our program is be a good trauma llama. So just know that that's all it takes. We just finished our Georgia Stay Safe. All right, so Rachel just won a t-shirt for those of y'all that don't know. Georgia Stay Safe Blitz just kind of happened. It's a summer-long program, so you can still use those resources if you go to www.preventtraumageorgia.com or www.georgiastaysafe.com. You'll be able to access those program materials. We were able to put out some new graphics this year. So if you need to refresh your Georgia Stay Safe graphics, there are some new ones, but the old ones are there and great too. Falls Prevention Month is coming up, as is Child Passenger Safety Month in September. I know a lot of us are going to be doing a lot of work in and around falls prevention, child passenger safety, also suicide. September is kind of like May, and it's one of those months where everything happens all at once. So if you need any help with those programs, let us know. Again, there's some resources for fall prevention there at the www.preventtraumageorgia.org too. So just let us know if we need to share. The folks with DPH and iPrice are going to be doing their Falls Free Friday webinars again. We don't yet have their calendar of events, but we will make sure to get them out to you as soon as they come out. Marie Probst worked with Jill Woodward. Obviously, some of y'all know I've been on a little bit of it FMLA intermittently, and so I have keeping pace has been difficult. Y'all have been tremendous help in that regard. And so one of the things that Marie did to kind of help with that was also make sure that our iPrice and DPH friends have your contact information so that they can get some of their event information and resources to you directly. For those of you that attended the iPrice or the statewide fall prevention task force meeting, I believe it was back in May, they did an excellent workshop on accessing and utilizing Georgia specific data and county level data, capturing emergency room data and fatality data that is not captured by our registries. That would be a good adjunct to you about figuring out some hot spots, showed us how to do some heat maps. So they offer those types of programs all the time, not just specific to fall prevention. They have several task forces that are run parallel to our own task force that are mechanism of injury specific. So if you have a good passion, check out the iPrice. It's Emory's Injury Prevention Center at Emory, the iPrice website. Check out their task force information, join their task forces. They definitely would love to have you in attendance. Some of you have been able to take advantage of some recent mini grants coming out of those programs. And so it's just a good way to connect with your partners and maybe even avail yourself of some grant funds without having to be always the principal investigator, the principal paperwork person, and all the other things. Leverage those partnerships because they have been awesome partners to us, and we want to continue to be awesome partners to them. Any questions? Heartburn? Okay. We have any hot spots that we realize from the Blitz? We are collecting information as to whether or not these folks are taking a refresher course or whether or not these folks are brand new to the Stop the Bleed program. Of course, we will be reaching out if we recognize there are any hot spots in your areas and trying to connect people that need the skills training portion with their local trauma centers and the local Stop the Bleed instructors.
All right, Crystal, thank you.
Trauma law. Nobody wants a t-shirt. Rachel got one though.
Well, there are a lot of hands going up, but I couldn't capture all the names, so I don't know if you were able to either.
No. Just wanted it out there. that just shows you how easy it is to share. I just shared it. I personally just sent it out to 4 people. There definitely were more than 4 hands out there. So that's how easy it is to share the information. And everybody's invited.
And I don't know, can you see the chat? Courtney Adams and Piedmont Newton, she would like for you to send her the email her the web information on the webinar. If you can, I can. I don't know if you're on your
I'm
phone.
not on a,
Thank
I'm
you
on
so
a
much.
I'm on a mobile device.
Okay,
Sorry.
I got it then. I'll send it to you, Courtney.
Thank you. I appreciate it.
Sure.
You want us to send it to the group? We can send it to the group as long as we
Yeah,
have
that
it.
would be great. Yeah.
That would be great. And just look for tomorrow morning. Most of y'all know I usually try to aggregate post-course surveys and give you a little information on how we're doing. So look for that first thing in the morning. But I would say the majority of people for those webinars, as a rule, sign up at the last minute. People that sign up early, things come up in their schedule and they often aren't able to make it. So do not feel like it's too late to share. We have people join, sign up, and we have it set up where as long as they sign up within 5 minutes of our start of our webinar, they'll still be able to get into the program.
Perfect. All right. Thank you, Crystal. Oh, also Stephanie put in the chat to join the iPrice Fall Prevention Task Force that meets bi-monthly. You can email iPrice, that's iprce@emory.edu for folks that can't see the chat.
Well, Stephanie, and Stephanie is with iPrice. Do you want to come off mute and give any other updates? And Rachel, do you want to maybe mention some of the changes we've made to the webinars? But Stephanie, if you want to mention something.
Hi everybody. I no longer work for iPrice, but I'm still very connected to them. However,
Sorry.
yeah, no worries, no worries. I still know much about it. So they meet bi-monthly, and Megan Passano, who might be on the call, not sure, but she's from DPH and she co-leads it, I believe. I don't know if Liz Head is still involved, but um I believe we're waiting for one more speaker to get approved so that we can put out the schedule for Falls Free Friday. So every Friday there will be some form of webinar that's in the morning or afternoon. And great folks that are on the call. We have high schoolers that are involved, college students, and such. So if you want to be more involved or see what's going on, and even get the updates based for the falls prevention, you can go ahead and email our price and they'll go ahead and add you to the listserv and or forward you all of the meeting updates.
Thank you, Stephanie.
Of course.
Rachel, and
Hey.
you want to?
Yeah, can you hear me?
Go ahead, Rachel.
All right, so for our webinars this year, this is the first time that we've kind of tried something new. So we're trying to incorporate one of our high school volunteers who wanted to get a little bit more involved. He's what did you say? He was majoring in like technology, digital world type stuff,
Yeah, so we're
cybersecurity.
teaching all the things not to do.
So, what we're doing is we're utilizing him. He has taken on a new role, and we lovingly refer to him as the UTL. So it is the ultimate trauma llama. And what that role does during the webinars is it engages people in the chat while the webinar is going on. So it keeps it lively, it keeps people entertained, it keeps them engaged, and it offers some additional quality context about the class and about the training that they're learning.
To grab what they ask for.
Building
It helps their brain. Like
Ashley, can you mute your line?
Equipment.
Thank you. Okay.
Yeah. The UTL is building his own job description. That's a part of the work that he's doing, and we're taking feedback from the audience. I offer that up as this may be an opportunity for some of you that have maybe kids that would like to volunteer and be involved in a different way in our trauma system down the road, because he's building his job description so somebody can maybe pick it up next time this rolls around. That's all, Glenn. That really is all.
Are you sure? Thank you, Crystal. I appreciate it. As always, lots and lots of great work. All right, so we'll move on to our new business. So Gabby sent out the standards that we picked for this time to review. The first one is the standard 2.7 trauma multidisciplinary PIPS committee. This is a type 1 deficiency, is applicable to all adult and pediatric centers. Just says that all trauma centers must have a trauma multidisciplinary PIPS committee chaired by the trauma medical director or an associate TMD. Combined adult level 1 and 2 and pediatric level 2 trauma centers must hold separate adult and pediatric trauma multidisciplinary PIPS meetings with distinct minutes. And for the measures of compliance, and when they come for your visit, this is what they want to see. They want to see the terms of reference that define the committee scope, the membership, frequency of meetings, and decision-making process. So we're level 3 center, and how we meet this compliance is we just add it into our PIPS plan, which I know a lot of people have done that, or you can have a separate policy if you want to, but it's easily add into your plan. Just make sure you do have these measures of compliance in there. Make sure you have the scope of the committee, your membership, your required meeting, attendance of each person, how often you hold the meeting. So for us at level 3, we just hold this meeting quarterly. And then how the decision-making process is handled in the policy. Like I said, we just incorporate it into our PIPS plan, but each one of these is defined out. So I don't know, Becky, if you have anything different from a level 1 center?
Yep. Similarly, ours is also incorporated into our PIPS plan. Our frequency is more often, though. We meet monthly for our multidisciplinary PIPS meeting, which is comprised of obviously our trauma surgery staff, our trauma liaisons, et cetera. So we meet monthly, and then from there, we kind of break off into some subgroups based on identified opportunities for improvement. So for instance, we have a quarterly meeting with our ortho liaisons where we, dig into some of the data or some of the issues that we've identified through our PIPS committee, and take that a little bit offline as opposed to having meetings that are entirely dedicated to one service only, and then bring all of that information back to the group. But it is chaired by our trauma medical director, Dr. Benjamin, and ultimately everything loops back through that committee for kind of final adjudication and awareness of all of the things that we're working on and all of the issues that we've identified, regardless of if they're pre-hospital or MT or ED for other places, our ED, if it's ICU, OR, et cetera. All of that flows back through the PIPS committee, just so everyone who's involved in the trauma throughput and trauma care of the continuum are aware of the things that we're working on.
Okay. Does anybody have anything different that they do that they'd like to share? Or any questions about this one? Okay. Well, just make sure it is in a policy, because that is when you go for your ACS for the PRQ, this is you do have to upload and show in compliance for this. So, all right. Well, that's a pretty much black and white one, I think. Pretty easy. So our next one was the 7.4 participation in risk adjusted benchmarking programs. And Stacy was going to discuss how they do that at her center.
Thanks. Hey, good afternoon, everyone. My name's Stacy Shipley. I'm the trauma registry manager at Grady Memorial Hospital. I oversee our trauma registry operations and data quality initiatives. But today I'd like to share how we approach ACS standard 7.04 and how we use the TQIP benchmark report as the foundation for a continuous performance improvement cycle rather than simply a report review exercise. So when a new benchmark report is released, our first step is to review the findings and identify outcomes or complications that appear higher or lower than we would have expected based on our internal monitoring. However, we don't immediately assume a benchmark signal represents a quality issue. So before we interpret the data, we validate our data. So that validation process is really critical, right? So we run registry reports, we review patient level records and evaluate inclusion criteria, abstraction practices, coding accuracy, and event definitions to ensure that, you know, we're all working from accurate information, or what we like to say at our center, like our sources of truth, right? So this helps us determine whether we're seeing a true clinical opportunity, a patient population characteristic, or a data capture issue. So once the data have been validated, we prioritize the highest frequency and highest impact hospital events. So those complications are brought forward to our monthly TQIP drill down meetings. This multidisciplinary meeting is led by our TMD. It includes trauma physicians and our program leadership. So the goal is to really move beyond that benchmark report rate and understand the story behind our data. So during the drill down process, we review patient level cases, we evaluate contributing factors, we discuss clinical workflows and documentation practices, and identify any opportunities where like interventions may improve outcomes. So this is where, you know, the benchmark report transitions from data into action, as I always like to say. We like to see our data in action. So following those discussions, improvement initiatives are assigned to physician and faculty champions. These projects may involve like education, guideline revisions, process redesign, documentation improvement, more focused monitoring. Examples like that we're currently working on at Grady include like our unplanned upgrade review process, our focused ventilator associated pneumonia reviews conducted jointly by our PI team and registry staff. We also have a geriatric trauma work group, which was developed from opportunities identified through our TQIP benchmarking. So because benchmark reports are retrospective, as we all know, we needed a way to monitor performance more real time between reporting cycles. So this is where our complication scorecard comes in. The scorecard tracks complications monthly using a patient population that closely mirrors the TQIP patient inclusion criteria. And so we compare our current performance against the most recent benchmark report rates to determine whether improvement efforts are having the desired impact and to identify trends before the next report is released. Like that's the goal, right? Like what's going on in our data right now. So the scorecard really has become an important tool for us. It allows us to keep a pulse on performance throughout the year, evaluate interventions, and proactively address emerging opportunities rather than waiting for that next benchmark cycle to come out. So finally, if we identify data quality concerns during this process, we increase scrutiny of those specific data elements before the next submission cycle. So this may include more focused registry reviews, more drill down reports, case level validation. You know, our end goal is to really just ensure that future benchmark reports accurately reflect both patient outcomes and the care being delivered, right? So all that, like in summary, like our interpretation of ACS 7.04 is that benchmarking is the starting point. It's really not that final step, right? We review the benchmark report. We're going to validate the data, drill into the priority events. We're going to assign ownership for improvement work, monitor progress through our complication scorecard, and continuously evaluate both performance and data quality, right? So that creates a cycle of benchmarking, intervention, and reassessment that really supports meaningful PI. And so again, like one of the strengths of our trauma registry community is our willingness to share tools and best practices, all the things, right? So I know that this scorecard has been really valuable for us at Grady, and we're happy to share that with anyone who may benefit from it. This template was actually shared with us several years ago by a colleague in the trauma registry community, Garrett Hall, and we've continued to build on it over time. So, but I'll go ahead, I'll drop my email in the chat if anyone's interested in the template. But that's all I have this afternoon. Thanks for your time today. Becky, Lynn, back to you.
Thank you, Stacy. That's very, very good information. And like you said, the TQIP data is very important. It's very useful, but it's old data. So having something that you can look at your concurrent data and compare that to, I think is fabulous. And that's really what we want to do. All this data is what we can do to improve it. What the things that we can implement and monitor it and make sure we improve our patient outcomes. So that's great. Thank you so much, Stacy, for all that. Does anybody else have anything else? And thank you for sharing your template too. I think that'd be very helpful. Does anybody have anything else on the benchmarking program?
Hey, it's Gina, and don't forget about Arbormetrics because it does have a risk adjusted piece to it. And although it's just benchmarking against other centers in Georgia, you can absolutely use it
Absolutely.
to help meet this metric. So, and the data is more real time. So, although it can augment your TQIP report and show trends. And that's why we've, kind of started the GQuip report card piece to kind of help feed some stuff back to you and hopefully drive you to the platform to use a little bit. So that's the tool that the commission helped pay for to give y'all some extra data because of the lag in the TQIP reports. So utilize that for your visits as well because it'll give you trends to show you how you're doing.
Yes, good point, Gina. Absolutely. GQuip has lots of great data as well to utilize and show where we are and what we're doing to improve. So thank you, Gina. Ashley said that her reviewers like their Arbor there.
That's great to hear.
All right. Does anybody have anything else on the standards? Okay, well, if nothing, our last is our roundtable discussion. So like Marie, she said there were 7 designations, re-verifications so far this year and several more that she wasn't able to say yet. But does anybody want to share their experiences, celebrations, learning situations, anything? Any advice to people who are about to go for their survey?
Share it all, please, y'all. We all want to know, what were they fixated on?
Yes. I'm going to start calling people out. No, I'm just kidding. Nobody has anything good to share? Any lessons
Hey,
learned?
this is Tommy from Savannah. Can you hear me?
Yes, Tommy. Thank you.
Hey, we just went through our level 1 adult re-verification. I think everything went very, very well. I think it's really dependent on your surveyors. Each surveyor has their own little, we'll call them pet peeves. So if you have that, if you know who your surveyors are going to be, I would reach out to see if anybody else has had those particular surveyors and knows them, like what their focus areas are.
True. That's a good point.
Because ours were, our first one focused more on, PIPs and the PI stuff, where the 2 we had this time really focused on one of their areas was non-surgical admits, was a big focus area for them this time. So I think it's very dependent on surveyors.
I think that's a good point, and I know probably a lot of folks sitting in the room are sitting there thinking, I really don't have a lot of time to invest in researching my surveyors, so I'm going to say something that make some of you cringe, but use your hospital approved AI tool, and ask specific, like for our injury prevention folks. I mean, your focus is an arrow on injury prevention, or if that's the portion of your survey that you're kind of worried about, maybe before you develop your presentation, ask those tools to research your surveys see what, they're passionate in and what may be their pet peeves, and tailor your messaging around them, their stuff. One thing that, I realized that, we're giving a lot of reports. They see that we do a large volume of stuff, that's evidence in the reports that we submit. But if we can really dial in on the things that they're passionate about and try to avoid spending a lot of effort on things that, maybe they are a little less passionate about, or maybe even suspicious of in some ways, you may find that your presentation, and this is true, within all the domains within our survey.
Great point. AI is a very useful tool for a lot of many things. All right, we got 45 minutes left, so what else y'all got? It's a quiet group today.
Know that, the visit always goes better in person than when it goes to the VRC. They are really tamping down, a lot more black and white. We had no deficiencies reported out for our visit, but we knew that we spoke to it very well and that our reviewers were very gracious, but the VRC did not agree with them. So we came back with a deficiency, which we figured we would get, but it did come back that way. So just don't be surprised. And keep those action plans in mind for the things that you think they're going to get you for, because they probably will.
True. Thank you, Ashley. Anybody else? All right. Well, I look forward to seeing everyone in a couple weeks in Jekyll. It's been a while since I've been able to see all of y'all, so I'm really looking forward to it. If we don't have anything else, do we have a motion to adjourn?
This is Anna Claire Cesario. I make a motion.
Thank you, Anna Claire.
That's second.
Thank you, Crystal. All right. Well, thank you all again so much for your time today. And like I said, I look forward to seeing everyone in Jekyll. Thank you.
Thank you. Have a good day.
Thanks,
You
y'all.
too.
Thank you.